Hello, my name is Philip Lamb and I will be presenting my epidemiology presentation on influenza. The article that I've chosen to perform a critique on is titled Age-Specific Differences in Influenza A Epidemic Curves. Do children drive the spread of influenza? This journal was studied and written by Dina Schanzer, Julie Vachon, and Louise Pelletier. So, to begin this presentation, I will begin by talking about what influenza is. Influenza is an acute respiratory disease that is extremely dangerous if not treated. The symptoms of this disease include onset of high fever, cough, headache, malaise, and inflammation of upper respiratory tract. Acute symptoms may persist for 7 to 10 days, while weakness and fatigue may last longer. People of all ages are affected, with majority of cases occurring during the winter. People at higher risk include those with diabetes mellitus and chronic pulmonary or cardiac disease. The virus peaks about 48 hours after inoculation and declines slowly. Recently, Vachon, Schanzer, and Pelletier performed a study on influenza with the purpose to quantify data to identify the age group for which influenza peaks first in the community. They hoped that the information they discovered would be useful in future treatment of an influenza epidemic. Their hypothesis was that younger school children are the leading cause of influenza epidemics. Previous research has shown that younger school-age children play a major role in the spread of influenza epidemics. This study used data from 1995 to 2006 from Canadian communities and laboratory hospital admissions for H1N1/2009 pandemic strain to support its hypothesis. As part of the National Surveillance Program, laboratories participating in this case-by-case program will report detailed epidemiologic information including age, sex, date of specimen collection, and community of residence for influenza A positive specimens. Clinicians in the course of clinical care and patient management in inpatient emergency room or outpatient settings and by physicians participating in the National Influenza Surveillance Program would be the ones to submit these specimens to the laboratories. During the 2009 H1N1 pandemic period, hospital admissions of patients with laboratory confirmation of the pandemic strain were reported to the Public Health Agency of Canada. Information reported to the Public Health Agency of Canada from 9 of 10 provinces, including information like age, date of symptom onset, specimen collection, or date of hospital admission and province of admission throughout the full 2009 pandemic period. Due to the intensive use of laboratory testing to identify H1N1 2009 infections in hospitalized patients over the 2009 period, laboratory confirmed admissions should provide the best temporally representative data source available for the fall pandemic wave, which led to the use of laboratory-confirmed hospital admissions as a substitution for the level of influenza activity during the pandemic period. After obtaining information from the Public Health Agency of Canada, an age-specific composite epidemic curve was created. Here, at least 25 cases per season and seasons where single influenza A strain predominated were included in the analysis. From the graphs created, there was a non-overlapping confidence interval that showed that there was a difference in timing of infections between the two age groups from the same epidemic. From there, the week of peak activity was noted for each group as well. And then a graph was created to visually show timing of each age group. After computing the numbers and creating graphs, the data was compared between 20 to 29-year-olds and 10 to 19-year-olds for the H3N2 season, and results came back and showed that 20 to 29-year-olds presented with these infections earlier. Also, data from the fall pandemic wave showed that the 10 to 19-year-old children presented with infection earlier than 4 to 9-year-old and 20 to 29-year-old. Therefore, it showed that it was not younger school age children that led to these influenza epidemics, because the older patients were presenting with influenza first. The analysis results showed that younger school age children do not lead to influenza epidemic waves, which disproves the author's hypothesis. There was a negative correlation between the data. Overall, these findings are important to public health because it gives us a better understanding of what age group to focus on when it comes to influenza. Furthermore, a research was done in Utah that supports the findings of Schanzer, Sean, and Pelletier's study. In their research in Utah, they found that influenza affected children ages 12 to 18 about 2 days before children 0 to 4 years old, and six days before adults older than 65 years old. Even though showed that younger children was not the leading cause of influenza epidemics, it still showed that children are at a high risk of obtaining this virus. As a public health official in the future, we should focus on education of children and encourage obtaining the flu vaccination. These findings apply to nursing because influenza is a common reason for people that end up at the hospital, and we are one of the first line defenses they have. Even though this shows that children are not the reason for flu epidemics, it still shows that people are still getting sick from this virus. Nurses will be working with patients, from infants to geriatrics, so it is important to be up to date with this information in order to provide the best professional care. I am interested in working in the pediatrics unit when I become a nurse, so learning more about how influenza affects children is extremely important to me. This study shows me that influenza is still a deadly virus, and more studies need to be done to prevent the disease. The strength of the article is that it was able to quantify data from the Canadian communities and laboratory admissions. The data obtained, with limitations though, was able to show that younger school-age children are not a leading reason for influenza epidemics. An example of one of the limitations within this study was that the data used was laboratory-confirmed admissions and not actual laboratory-confirmed cases. The 1-week time interval between youth and older adults is short. Also, it is not geographically representative because age was given priority. The difference in lead times is extremely short, and that is enough to potentially cause bias within the age-specific risks that were calculated in their effect in causing an epidemic. This article's data shows that children are not the leading cause of flu epidemics. This means that something else is leading to epidemics, and it is important to continue to research to decrease the spread of this virus. In conclusion, the study found that younger children are not the leading cause of influenza pandemics. Information was gathered from Canadian communities and laboratory hospital admissions and turned into analyzable data. The study is important for healthcare. The study is important finding for healthcare, but there are still limitations. More research needs to be done in order to learn more about how to prevent influenza pandemics. The reason for choosing this article is mainly because I knew the influenza season was about to begin. From there, this article was extremely interesting to myself because knowing which age group tend to cause a pandemic would allow us as nurses to know which age group needs priority care. Lastly, I chose this because I'm interested in being a pediatric nurse in the future. Thank you.